Obviously, you've been exposed to the importance of nutrition when it comes to health. And now we're going to get into more of the structure side. In other words, if you all are Ferraris and you're putting bad gas in that Ferrari, are you going to function properly? And the answer is no. If you're a Ferrari that's running on 8 cylinders instead of 12, and you feed it good nutrition, are you going to have proper health? So we're getting at both ends of this here. One is the nutritional side, is what type of gas are you putting in your engine? And now I'm going to talk to you about the engine part of this. So let's get into this. How do you have a long, healthy life? A woman walked up to a wrinkled little old man rocking in a chair on his porch. I couldn't help noticing how happy you look, she said. What's your secret for a happy, long life? I smoke 3 packs of cigarettes a day. I also drink a case of whiskey a week. I eat fatty foods and never exercise. That's amazing, the woman said. How old are you? 23. I just described my brother. So, anybody recognize this? This is who I worked for. And I used to have a head full of hair before I started working for these people. This is the U.S. Department of Energy nuclear weapons program. And I didn't say nuclear power, nuclear weapons. I obtained a Q security clearance, which is the highest security clearance you can have in this nation. I could have walked into the Pentagon unescorted. And I always have to watch my back now to make sure I'm not going to get kidnapped by somebody. Eventually, that's what I got into. But I worked in the field of nuclear engineering for 7 years. And I designed, developed nuclear weapons for Navy submarines. So when I talk about health, I don't talk about health and maintaining your health. I talk about an engineer, how an engineer would look at your health, because it's much different. Because I don't know if we have any engineers in here, but engineers, I know there's one, engineers are obsessed with trying to figure things out, okay? And although I figured out real well how to take uranium out of rods and deplete them in a separations facility and make 2 half spheres and put them in the front of a warhead, and as soon as on collision those spheres come together and a criticality happens and you got a nuclear weapon. And that sounds real complicated, and it was. But it is not 1/10 as complicated as the human body. So I want to get into talking to you from an engineering perspective about structure and function. And we're going to get into some of this. And it's amazing if you look at the definition of engineering. How cool would it be to have a doctor just like this? Okay, and we'll read this out loud. Engineering is the science, the skill, the profession of acquiring and applying scientific, economic, social, and practical knowledge in order to design, build, maintain structures, machines, devices, systems, materials, and processes. In layman's terms, it is the act of using insights to conceive, model, and scale a solution to a problem. So that's really the question I have for all of you. Is when's the last time your doctor looked at you from this perspective? What is wrong with your health? And really being focused on the problem, the cause, not the effects. Because what we see here, the pills, and when we had these posters designed, I was really reluctant to put pills on there because I didn't want people to say, oh, this is just another, somebody's trying to sell something here. We don't have anything to sell today. It's an expo because the most valuable thing that Dr. Wolfson or myself can give you is knowledge. And that's what you're going to gain today. And I know that you've already gained a ton of knowledge. So I'm going to take you on a journey. And I'm going to convince you just how mechanical you are. So we're going to look at some of this more. The assessment of nuclear engineering. One of the things that I was involved with, number one, is I had to look for signs of structure degeneration. I also had to look for signs of malfunction. So basically, I analyzed structure and function. Okay? What do I mean by that? Well, we look at structural degeneration, is what this picture is on top. Okay? If we look at malfunction, we see the picture on the bottom. Everybody can relate to that, right? What just happened in Japan, what happened in Chernobyl, what happened even here in the U.S. But this is something that equals something. What do I mean by that? That means structural degeneration leads to malfunction. How does that apply to you in your health? Why do things degenerate? So in other words, your car sitting in the parking lot right now, is it becoming newer or is it becoming older? What do you think? Is your body becoming newer or older as you sit here? Let's look at this. The second law of thermodynamics. These are laws, these are proven laws, they're physics. They deal with heat transfer. They deal with mechanical operation. And if you're an engineer, you know you didn't become an engineer no matter what kind of engineer you are unless you understood this. So we look at the second law is concerned with this word called entropy. And what does entropy mean? It's the measure of disorder. That means that all things tend towards disorder. Right? How many of you don't believe that? Right? Look, those of you that aren't like me and you have a nice head of hair and you go to bed and you wake up the next morning, what's wrong with your hair? Disorder. Right? So the second law says that entropy of the universe increases. Now, we're not going to talk about universe and do all this stuff. But the point I'm trying to make with this is that the law, entropy, the law of disorder increases all the time with all things. And the only way to stop entropy from increasing is to introduce energy. So let's get into this a little bit more. The second law of thermodynamics, entropy. If we have a block of ice, we have an increase in entropy if it turns into disorder puddle. A puddle of water is disorder. We have a decrease in entropy if we take disorder and create order. Make sense? That's about as confusing as I'm going to get with physics. All right? Structure degeneration equals malfunction. Okay? So if we look at this, do we call it degenerative tire disease? What do you think? But when you begin to degenerate, we call it a disease process. I don't. But common medicine does. So, what do we see about this tire? Is it wearing all the way across? Is it wearing on one side? What do you think? What do you see? What do you see different here versus there? So why would it do that?
Out of alignment.
Oh, you guys know where I'm going already. Let's not even say the word misalignment. We're going to say that's the law of entropy. This is the second law of thermodynamics applying to an automobile. The problem is, this is an increase in entropy, and this is just the normal aging process or the normal entropy. Okay? And of course, the end result if you neglect entropy is what? Can we get from here back to there? You cannot. So there is a point of no return. Does this reverse the second law of thermodynamics? What does it do?
Gives you a Band-Aid.
It buys you a little bit more what? It buys you a little bit more time. Similar to what this stuff does. Okay? So what about this? We have this show going on this weekend, right? Mm-hmm. And you all, let me ask you, what do you think the value of that car is? If you had a wallet that looked like a Bible, all those pages in there, and you could buy that car, what would you value that car at?
$2.3 million.
Yeah. What's the value of a human life? Right? It's funny because I'm a research guru. I love it. As you can see, all of this stuff up here. Not one thing, anytime I lecture, whether I'm talking on TV like I was this morning on Fox News, not one single tiny 1/10 of an ounce of it is my opinion. All right, because not even my wife in the back wants to hear my opinion, so I know you guys don't. This is all facts. So my question would be, if I crank this thing up, and I went to valet park it, at Scottsdale Fashion Center, and people are sitting out there at Kuna, what's the name of the restaurant there? Kona Grill. And they're drinking their wine, and I pull up in this thing with my wife, and then I cut it off, and then the valet guy cranks it up, and it makes a smoke storm. They're like, oh, that thing's been neglected. He needs to put some oil treatment in there, and that will take care of that smoke. Would you do that to a car like that? And then the question is, would you take care of your heart with pharmaceuticals instead of what Dr. Wolfson's talking about? Or would you take care of your mechanical structure that the same laws of thermodynamics are applying to on a daily basis as we're sitting here? So my question would be this. How old are these tires if you didn't know how old they are? Could you tell by looking at these tires? Okay. So enough talking about cars and tires. So let me ask you this. How old would you be if you didn't know how old you are? Huh? You're out playing golf, right? And you're all done. And then, before I played golf, I felt like I was, in my lower 40s. And now I feel like I'm in my upper 70s, right? Or the better one is when you first get out of bed in the morning and you walk like an old man like this, right? Your body is stuck in flexion, right? So we're going to get into flexion and why that's bad for you. So let's look at this. The assessment of your age. This looked like a familiar slide just went through in engineering sense. Look for signs of structure degeneration. Has your doctor done that to you recently? And does he even know how? Look for signs of malfunction, right? So we know structure and function in an engineering sense, but what do we call structure and function in a body sense? What do we call that? It's called anatomy and physiology. And those same laws that apply to structure and function in engineering also apply to you anatomy and physiology-wise. Good nutrition will improve all of this. Okay? But the cylinder's got to be running as well. So let's get into this a little bit more. Structural degeneration leads to malfunction. Just like the rusty pipe, just like the collapse of a structure, that's what we're seeing here. This is the collapse of a structure. This is worse to me than a nuclear incident. This is a shame. Because this is ultimately a malfunction of anatomy and physiology. And of course, this is what Dr. Wolfson's already addressed. Okay? So, managing the second law of thermodynamics. Let's take a look at this a little more. So we have order going to disorder, and then we have disorder going to order, changes in entropy, changes in the second law of thermodynamics. And then we see disorder going to order. And then if you're not paying attention, what can happen to order? Right? Go back and forth. So get this cycle going on. So it's important to understand the same laws of mechanics apply to you and your health. Structure and function equals anatomy and physiology. So we have to look at this a little bit more. How many of you believe that you are mechanical? Some of you aren't sure. And every time I lecture, I have to convince people that. It's kind of like saying, I'm going to convince you the world is round when you've been told it's flat. Okay? So let's take a ride in history. The father of modern, not medicine, but philosophy. He says, René Descartes says, passions of the soul in the description of the human body suggested that the body works like a machine that has material properties. I'm not sure where that's coming from. How's that? A machine. When's the last time you've been told you're a machine? Guys? All right? I haven't. The father of modern medicine. Hippocrates was an ancient Greek physician of the age of the Pericles, and is considered one of the most outstanding figures in the history of medicine. Hippocrates' own theory of medicine did argue the explanation of disease or health to be the casual breakdown of the body's mechanics. That's the second law of thermodynamics. It's always been there, like gravity, and it's always going to be there. And you are slowly decaying and degenerating unless you stop that by introducing some form of energy. And medications are not energy. They're buying you time. It's fix a flat and a tire. So let's look at this more. Biomechanics. It's interesting because on Fox News this morning I did a segment on explaining what happens to a runner. And my assistant Mindy was back there with me bending all over the ball. Because I know I couldn't do that. I would have fell off of it. But the bottom line is, when I started talking and he started interviewing me, he wanted me to talk about how do you stretch and do all these things. And I wasn't going to go there. I've been on TV enough that I know if you give them a list of questions to ask you, they're going to go right down that list. But if you don't give them a list of questions and they start off with a question, then you get to run with it. And you got 3, 4, 5 minutes to run with it. And this is what I ran with. I said, first of all, after any kind of physical exercise, marathon, and we were talking about marathons, the body is mechanical. And that science of healthcare is called biomechanics. Bio meaning life, mechanics meaning the same laws of mechanics that apply to an automobile apply to you. And he didn't understand what I was talking about. He's never even heard this word before. Okay? So the human body is the only machine which there are no spare parts. You know, and as my experience in engineering tells me, a hip replacement and a knee replacement, one size fits all. Right? It doesn't. And we have not mastered anatomical parts. And when you wear parts out in the human body, you wear them out. And when they're replaced, you're never as good as you were. Okay? The second one, the human body is a machine which winds its own springs. So there's all of these hints in history about you being mechanical. Even this guy. All right? And I'm sure you all have seen this. Every chiropractor in the world throws this slide up there, blah, 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 blah. But the doctor of the future will give no medicine but interest his patients in the care of the human frame. Human frame. Mechanics. Mechanical. In diet, as Dr. Wolfson talked about. And the cause and prevention of disease. See, everybody is worried about Obamacare and figuring out how the heck is my prescription coverage, how am I going to benefit? I got to get good prescription coverage. That's all I'm worried about, prescription coverage. No, you shouldn't worry about that. It should have no bearing on you and your health destiny. Should be focused on that right there. And as many times I've talked about engineering and structural health care, I can't help but going back to that slide because it says it all in a nutshell. Just how mechanical are you? Human biomechanics is the study of mechanical laws, like I just went over with you, and their application to living organisms, especially the human body and its locomotor system. What's locomotor system? That's getting from point A to point B. And any time and every time I lecture, I always, and this is my one little opinion point, is when you lose mobility, you're going to lose your health. Bottom line. And see, there are a few people that left because they thought I was going to get up here and do a talk about you got to get your back cracked and your neck twisted off. Otherwise, I'm going to sell you on chiropractic. I'm not even going to mention the word chiropractic. I'm going to try not to. And I don't think I really have up to this point. Okay? But you can't help but look at this and look at that and not say, yeah, you know what, that is mechanical. And as we're sitting here today, that is degenerating. It's decaying. Just like an automobile, just like anything else that's in this world. We know that. So, let's look at this a little more. And the concepts in human factors engineering the body as a machine. This is taken out of an excerpt written by a PhD. He says the biomechanics have been around for many years. If I stopped right there, I want you to listen to this one. This is one of the most important slides. Biomechanics have been around for many, many, many years is what I would have said if I'd written this article. Relatively recently, universities have decided to create a curriculum devoted to this subject. What does that translate into normal English? Do you think your doctor even knows how to spell the word biomechanics? I beg to challenge him on that. Biomechanics is simply a term used to describe the combining of the human body with mechanics. Biomechanics involves mathematics, physics, anatomy, physiology, among other subjects. The body is considered to act as a machine using mechanical parts. What's the name of this? A ball and socket joint. No fancy medical terminology. A hinge joint, right? This hinge joint will never get rusty on me, I can promise you, because it's always moving. Another ball and socket joint, a hinge joint, rotational joint. These are all, it's the same words. And if you go to Home Depot to do a backyard project, you're going to look for these same words in there. Any medical book is going to describe your musculoskeletal system with mechanical parts. Okay? That's what this is all about. This is very similar to the definition of engineering I put up there earlier. So, anatomy equals our structures, right? Structures. And I'm from Georgia, so I can say guts, right? I can say guts. So, physiology means how those structures function. So, if we look at this structure, this mechanical structure, we have 5 lumbars in most people, we have 12 thoracics, and we have 7. We have 24 bones, the tailbone, the sacrum. That's why the name of my clinic is called FIX24. I have people come in there, they're bringing cameras, they're bringing VCRs, they're bringing DVD players all the time. I finally had to put the word, I didn't want to, but I had to put the word chiropractic underneath it. And I even had a guy brought his watch to me and said, "Can you fix that?" Okay? So 24 movable bones, 24 mechanical bones. 24 bones that are susceptible to the second law of thermodynamics. And through the arrangement of these bones, they're designed to give you flexibility and mobility. If they are all properly aligned from the back to the front, and notice I didn't say twisted, because I do not agree with that. I do not believe in that. But if they are set from the back to the front, then we have no compression on the nerves that control these organs. And every organ is connected to that spinal cord by a nerve that comes out of the mechanical alignment of that spinal cord. And none of them can survive if you disconnect them from that spinal cord, except one. And that's the one my friend just lectured on. Okay? So that's why I thought it would be a great way for he and I to talk about your overall health care. So let's look at this in more detail. And we're going to talk about a few diseases here. Here's the picture, the real picture. This is an A to P x-ray. P to A x-ray is how we read it. And then a lateral x-ray, showing everything from below the eyes to mid-thigh. And I don't look at anybody with a structural problem unless I have this, which is in an engineering sense. If I was going to construct a bridge, what would I have in order to guide me in that construction? What would I have to develop first? A set of what? Blueprints. And so red flag number 1, going into, and I won't mention any names here, the joint, is a facility where you can just walk in, no x-rays, no exam, no appointment, just come on in and get your back cracked. And that's exactly what you're going to get. Is that going to change anatomy and physiology? No. It isn't. And this is the problem when I say the word chiropractic versus talking biomechanics. Okay? As you can see, this is extremely mechanical. And when something begins to break down or degenerate or malfunction, we cannot correct that with pharmaceuticals. It will never happen. You can buy yourself more time, but you cannot correct the problem. You can treat the effects, but you can't correct the cause. So let's look at this a little bit more in detail. If we look at structure and function, we're going to talk about structure and function all in one shot here. If we look at the normal anatomy, say a few bones from the side, and this is the front and this is the back, and this is the bone, the vertebral body. This is the disc or the cushion, and here's a bone, a disc, a bone, a disc, a bone. And then behind those bones, we have the spinal cord. Now I'm going to say that 3 times because that is one of the most crucial points I want to make today, is that the neurology is behind the bones. Okay? The neurology is behind the bones. The nerves are behind the bones. So when the nerves go down through the canal, there's openings that are formed by the alignment of these vertebrae. Only if those vertebrae are pushed into their interlocked position. And those openings will allow that nerve, which is called a peripheral nerve, because it goes into the periphery. Sound familiar if you get a diagnosis of peripheral neuropathy? Neuropathy, neuropathy, something wrong with. Something wrong with the peripheral nerve. That's what what does diagnosis mean when you translate that from the Greek? Di means what? 2. Agnos means don't know. There's 2 people that don't know. True. So here we see normal anatomy, normal function. Then we have the tire with the front end that's out of alignment. This is what happens to anything that is mechanical. In fact, tell me one thing that's mechanical that does not have to be maintained mechanically. It's quiet. You are mechanical. And what happens here is that these vertebrae, when they mechanically misalign, in 99.99 cases, there's some weird cases like spondylolisthesis where there's some forward slippage of the vertebra where there's a malformation. But in the most cases, the vertebra is going to shift backwards. And this is going to happen when you have an unguarded sneeze, when you have an accident, when you're driving your car through a Walmart parking lot and you hit a speed bump. Now you've increased entropy. And when you bend over to pick something up, what happens translational in these individual vertebrae? They shift out of place. But they don't go forward when they shift out of place. They go backwards. And what did I say 3 times was behind those bones? Nerves. That's a problem. And this is what we see. We see normal mechanics, and we see the second law of thermodynamics in action, because it's going to happen. Now, I'm going to tell you all the diseases that the medical profession is going to tell you have associated with increase in entropy. Number 1, you're going to have degenerative disc disease. You're going to have degenerative joint disease. You're going to have osteoarthritis, bone spurring. You're going to have spinal stenosis, which means narrowing of an opening when you translate that. You're going to have neuropathy wherever that nerve goes to, because a nerve cannot sustain pressure on it. It decreases electrical impulses. How many of you believe, those of you my patients have heard this one, right? How many of you don't believe it's electrical impulses that travel down those nerves? Not sure, right? So I'm going to look for a volunteer, and I'm going to have you come up. I'm going to find this little groove here called the ulnar nerve, and I'm going to have you whack it right there. Then we're going to see what happens to the pinky. And if you don't say, yeah, okay, it's electricity in there. Because it is. When you go to a neurologist and you wait all that time to get, and I'm going to Mayo, because they're the best. And I'm going to wait all this time for a neurologist. All he does is he's measuring that conductivity, that electrical impulses. In engineering, if we slow down electrical impulses in a wire, in our system, it's called impedance. In medicine, we call it compression on a nerve. And the resolution for compression on a nerve or impedance for electricity is, here, take Neurontin. That's going to buy you some more time. So, spinal stenosis is one of the things that I preach and teach about is a mechanical problem. Second to this is degenerative changes in arthritis that will also narrow that hole. But when that bone goes backwards, it's going to damage the nerves. And what happens to those nerves that travel out of that little opening that should be like this, that have been compromised to that? Is it disease or is it misalignment? Is it disease or is it misalignment? Because, and I've heard this one, I love this one, well, you know, automatically if you have gray hair or you have no hair, it's because of your age. You got arthritis, right? Your discs are wearing away because it's your age. But this is the same age. Does that disc look anything like this one? And it doesn't take a radiologist to see that. And the other thing that's present that we barely see up in here, is very apparent down here, is arthritis. So I'm going to talk to you a little bit more about arthritis. Is it going to be my opinion? What do you think? Of course not. Nobody wants to hear my opinion. Here are the individual bones, right? Here's where the belly would be, unless you're one of Dr. Wolfson's patients, you won't have one. Here's where the back is, and here's the opening for the nerve. Because we know the nerves are where? Behind the bones. Behind the bones, behind the bones, behind the bones. So here's the spinal cord coming down, and what's happened progressively with these openings? They get more and more and more narrow. And you're being told that's your age and that you need surgery for that. Okay? As soon as I hear the word spinal surgery, I'm thinking as an engineer, duct tape and chewing gum. And I debate surgeons. I've lectured to other doctors about biomechanics, not as a chiropractor, because I really don't even consider myself a chiropractor. Right? I know I'm supposed to have that pride and all that. There's an awful lot of nonsense, unfortunately, that occurs in chiropractic. Inconsistencies. Okay? This is not age-related, folks. This is mechanical laws applying to your spine. The question is, what do you do about that? Do you put Fix-a-Flat in there to buy you some more time? Do you put Celebrex in here to buy you some more time? And what's the #1 prescription for pain? Anti-what? Not even anti-inflammatories, antidepressants. It's all up here. Yeah. Well, this is what Time magazine says about mechanics and alignment. It says the coming epidemic of arthritis. The bad news is the research shows that the disease starts attacking your joints long before middle age. This is very true because I've seen 21, 22, 23-year-olds with arthritis in their spine. The good news is the latest treatments are more effective than others. Then you go inside, you flip through, and there's a double picture there of a guy holding his knee. And this is the article. You can look it up online. And that's the picture of the guy holding his knee. I want to read to you what it says underneath the caption. It says, knee. New studies show that runners are at no great risk of arthritis as long as the joints are properly aligned. People living in Scottsdale, Arizona, are at no great risk of arthritis in their spine as long as the joints are properly aligned. Is that any different? Or should we take Celebrex? And then you're sitting there eating a good paleo diet, watching TV, and you probably shouldn't eat and watch TV. I guarantee you Dr. Jack Wilson's going to say something about that, right? But you're watching TV, and lo and behold, you're looking, you're like, wow. And what do? You pull your wallet out, and you unroll that list of medications, and you say, there's a commercial there of an attorney saying if you're taking this, there's a lawsuit going on. Don't get caught up in that. What happens to the nerves when they're compressed? Like the x-ray that I showed you. Like the graphic that I showed you. Well, one is we know what we feel. You leave a nerve compressed long enough, and if you don't believe me, stick your thumb on the median nerve and push as hard as you can, then take your hand and keep doing this for about 30 minutes. And you're going to find you got no function in your hand. You're going to find it's numb. And then you're going to get a diagnosis that you have a carpal tunnel syndrome. And the definition of a syndrome, if you've never looked at that, a definition of a syndrome is a collection of symptoms. That's all it is. So as soon as somebody says, I have fibromyalgia syndrome, or I don't doubt that you have muscle pain, but people that are paralyzed don't have muscle pain. It's about the nerves. Or I have carpal tunnel syndrome. I need surgery. Okay? It's just not true. So my question is, we know what happens when we compress a nerve. You know, we get that numbness on the bottom of the foot, and then it starts spreading up the leg, or, you know, we're doing one of these things, I got a pinched nerve. and you go to your doctor and he writes you a prescription for muscle relaxers because the muscles are doing this. But is it a muscle problem or is it a nerve problem that goes to that muscle? Okay? That's the question I have to ask. So, if we look at the rest of the anatomy here, that is what's affected. How do we know that? This is an interesting study. Henry Windsor was a medical doctor in Haddonfield, Pennsylvania. He asked the question, chiropractors claim by adjusting one vertebra they can relieve stomach troubles and ulcers by adjusting other, menstrual cramps, and by adjusting other conditions such as kidney disease, constipation, heart disease, thyroid problems, and lung disease may resolve, but how? Because that sounds real wacky. What do you think? After graduating medical school, not chiropractic school, Dr. Windsor was inspired to research. He planned to dissect human and animal cadavers to see if there was a relationship between any diseased internal organ discovered on an autopsy and the vertebra associated with the nerves that went to that organ. Pretty straightforward. I'm got my attention here. The object of these necropsies, which are dissections, was to determine whether any connection existed between minor curvatures of the spine, on one hand, and diseased organs, on the other hand. Or was there no relationship? What do you think? The University of Pennsylvania, not Scottsdale Community College, although I think that's a good school, gave Dr. Windsor permission to carry out his experiments. In a series of 3 studies, he dissected a total of 75 human and 25 cat cadavers. The following are Dr. Windsor's results. Let's take a break. You guys want to take a break? No, we won't do that. 221 structures other than the spine were found diseased. Of these, 212 were observed to belong to the same sympathetic nerve segments as the vertebra and curvature, mechanics. 9 diseased organs belong to different sympathetic segments from the vertebra out of alignment. In other words, there was nearly a 10% correlation. A 10%? 100% correlation between minor curvatures of the spine and diseased organs, internal organs. And here is just a few of the results. Stomach diseases. A little bit of the cases had spinal misalignment in the all 9 cases had spinal misalignments, the law of entropy, the second law of thermodynamics. In the mid-thoracic, T5, T9 died. Not got sick, but died. Causes of death from stomach disease. And you're told you need the purple pill. The lung disease, all 26 cases of lung disease, all had spinal misalignments in the upper thoracic spine. Because the lungs can't function without nerve innervation. And where does every single nerve come from? The mechanical entity of this spinal column. And just like the front end of your car is going to misalign, except we're not just wearing away tires here. This is known as the silent killer. Okay? Gallstones, and you're told the reason you have gallstones is because your mother had them. I have a 17-year-old case. In my office, it's way over in Peoria. We have 2. One in Scottsdale, one in Peoria. Father brought him in as a last resort. My son's been homeschooled, can't figure out what's wrong. He has severe digestion. He's losing weight like crazy. He just has gallbladder removed. And I'm thinking, if I had hair, I would have pulled it out. 17 years old and his gallbladder's been removed. Folks, you were created with no spare parts. And I want you to understand that, okay? The pancreas, all 3 cases of pancreas disease had spinal misalignments. What does the pancreas contribute to? What disease process? So if you're eating terrible foods, driving your blood sugar all over the place, and you have structural mechanical misalignments compressing the nerve that goes to the pancreas, now your beta cells aren't producing insulin like they should be, and we have an imbalance going on. And what do you need in your arsenal? You need 2 doctors like us. Both ways. Okay? The liver story. Okay? I'm going to give you a slide about the liver, and you'll be shocked. I won't even get into that one. Kidneys. Okay, prostate. This is the one I love. Guys will have to understand the same neurological supply that comes out of that lower back. When we have a mechanical misalignment of these structures and they're sitting in there like that and they go backwards into the what? into the nerves. That's going to alter function wherever it goes to. One branch, of course, is going to go down the leg, feeds the sciatic nerve all the way down to the big toe. But that other branch goes into the reproductive organs. It goes into the prostate. So guys end up with low back pain, all of a sudden, they're beginning to malfunction, and they got ED. And what are they doing? They're going and they're getting some of this, and that's going to fix your ED problem. It's not. It's the same thing as that rusty pipe leading to the fall of the structure. Okay? And I don't mean a pun by that, fall of the structure, right? Bladder disease. Females have weak bladder as you get older. It's not because you're getting older. It's because of the law of entropy. And how do you reverse that? You look at yourself just like a fine-tuned Barrett-Jackson automobile. And you have to understand that there are alternatives. Not every chiropractor grabs the neck and twists it off and rips you this way and rips you that way. There are over 200 different methods of chiropractic. In fact, the method that I do was developed by a mechanical engineer. There are 6 of us in the state of Arizona. There's 2,400 chiropractors. Okay? 6 of us. And most of us have technical, if not engineering backgrounds. It's not a rack and crack like the normal chiropractic stuff that you see out there. A bunch of nonsense. There's more science to it. But my point for bringing this up is that if you have a water spigot, and you have a water hose, and you have a palm tree, and in an engineering sense, that's called a system. Now, if my wife comes home and she parks the car on the hose and leaves it there, right, Sal? What happens to the palm tree? It begins to break down, disease, and die. So do we go to the nursery and bring some chemical fertilizer to throw on that tree and expect to see a result? Or do we find out what's happened to the system? Okay? You have to look at your body. You aren't given a bad deck of cards. You were designed to be healthy. And when you're not healthy, just like that definition of engineering, you got to find a doctor who's going to look at you from this perspective and figure out what is the cause that's creating these effects. Because these disease processes were brought on by mechanical structural misalignment and nerve compression. So it isn't about cracking your back and getting rid of headaches. It's about maintaining those 12 cylinders so that when you put the great gas in it, you don't have to worry about Obamacare. I don't care about Obamacare. I practice what I preach Monday through Friday with the diet part. On the weekends I get a little crazy, but I maintain myself structurally. And I'm not even going to tell you how old I am. All right? My wife doesn't like when I do that. But I'm not that joke that I put up there, okay? So let's look at this realistically. Now I know this is hard to see because of the lighting. But these are all different patients, different cases. And one of the things that's unique is they all have structural misalignments right here, right here, right here, and right there. And the other thing you'll notice is this little white dot right there, right there, right there, and right there. That little white dot is the remnants of a gallbladder that has been removed from the body. And they're called staples. Because the gallbladder was removed. Because where that nerve was damaged from those structural misalignments. And those range from 81 years old to 21 years old. Age has nothing to do with it. Okay? What's the cause? The cause is flexion. The cause is flexion. What does that mean? That means if you've ever bent over to tie your shoes, or you go to a rec center and you're told you need to bend over and touch your toes, that's good for flexibility, right? Or you're told at another exercise class to take your neck and stretch it down like this. That's called flexion when we talk about ranges of motion. Flexion is your enemy. And in a 24-hour time period, how much time do you spend with your body in flexion versus this range of motion called extension? Because an interesting thing will happen. If this is my belt buckle, I'm still trying to figure out how to make that happen. But if I put this here and I bend over in flexion, is this going to move towards that wall or this wall? What do you think? It's going that way. So when we bend over in flexion, guess what happens to the bones? They're going posterior. They're going backwards. And what did I say? 3 times was behind the bones. Nerves. Just the opposite. Here's the belt buckle. Now, if I give my body an extension, where is it going? It's going forward and up. If that bone went forward and up, would we see the spinal cord do that? That's an MRI. And clearly, we see a bone that's gone back, and we see a disc, we see the bone. This is the spinal cord coming down, ends about up in there, and there's the remnants of the spinal cord. And then right here, boom. That's the second law of thermodynamics. And that disc is the second law of thermodynamics, because that disc is the same age, right? And so what are you going to do there? You're going to go to Mayo Clinic, and you're going to get the diagnosis of spinal stenosis, right? Here's the Mayo Clinic newsletter. It's headline, spinal stenosis. And you know what the first thing it says? Spinal stenosis, pain often age-related. This has nothing to do with your age. Okay? So what's the course of correction at the Mayo Clinic with spinal stenosis? What do you think the first thing is? Oh, what's MD stand for?
More drugs.
More drugs. All right. Acetaminophen, Tylenol, non-steroidal anti-inflammatory drugs, ibuprofen, naproxen. Some studies have even shown certain antidepressants. And this goes on and on and on. Neurontin is on there. Okay, that doesn't work. What's the next thing to do? What's a little bit more conservative, and I think is a great science? It's called physical therapy. Physical therapy does not correct biomechanical misalignments. It doesn't. You correct that biomechanical misalignment, then you have physical therapy to maintain it there. And then what's the last thing? Or second to the last thing? An injection of what?
Steroids.
Steroids, corticosteroids. And why do they say you're only allowed to have 3 per year? Because is that your insurance coverage? It is that hazardous that it will cause other joints in your body to collapse. Because if you look at cortisone, in the Greek translation of that, it means excise, to chemically excise. So when you get a cortisone shot, it has an affinity for inflamed tissue. And what does it do? It eats and dissolves that inflamed tissue, the tendons, the ligaments, the muscles, anything that's soft tissue. That's why they only give you 3. And I have studies all up in here, and I'll show them to you when we're done, where there's a picture taken of somebody's ankle, they get 3 cortisone shots, and they take the picture again. And guess what's formed where the shots are? A pit, a depression in the soft tissue, where there used to be soft tissue. And this is the answer. The best clinic, I hear this all the time, and I'm not even going to go off on this. This is not even a good alternative. This is just a more expensive version of Fix-A-Flat. That's what this is. And there's better alternatives out there for your health. This is what we do all day. We're at computers, right? We're getting clothes out of the dryer, dishes out of the dishwasher. We're sitting on the toilet, right? Everything that we're sleeping in the fetal position. All of those things, accumulative, are flexion. We're golfing, I work with pro golfers, and the first thing I tell them, all you do all day long is put your body in flexion. Do you ever put your body in extension? No. So you have to put your body in extension, okay? And that's what, when we mechanically push that bone forward, push it forward, not twist it, but push that bone forward, it relieves the stress off the neurology. Function improves. Pain decreases. What happens to an ankle when you step off a curb and you twist it out of place? What does it do? Let me back up. If I am an automotive mechanic, and I'm going to use one of these things, because I have a crazy sounding noise under the hood of my car. I'm going to take it to a mechanic, and an engineer hopefully is going to look at this and he's going to say, one of the things I look for is vibration. And vibration creates friction. And friction radiates heat. And when you sprain an ankle, you mechanically misalign that joint. And from a doctor's perspective, we call that swelling, and inflammation. From an engineering perspective, we call it heat. So you check people for heat. It's the same concept, the same mechanical laws that apply to a motor. We put this on the spine, and we run this down the spine, and if we see abnormal levels of heat, you have mechanical misalignment. If you have mechanical misalignment, you have inflammation. If you have inflammation and mechanical misalignment, you're going to have nerve compression. If you have nerve compression, you have altered function. You have altered function and it's not addressed, the law of entropy will conclude with you having a diseased organ. Don't even try to make me repeat that one. Heat. Nobody gets an X-ray unless there's heat present. And certainly, how can you correct this mechanical structure without a blueprint? And I'm not a fan of MRIs. Again, as an engineer, I analyze structures under load, weight bearing. Not on your back, run you through a tube, and I'm going to make a diagnosis about your mechanical problem saying you need Neurontin for that stenosis or surgery. Because what are they going to do with surgery? They're going to do something with a remount called a laminectomy, which is all the way back here. It's on the backside bones. You can't do surgery and push that bone off that nerve. Cannot be done. Treating the symptoms, which are the effects, instead of the cause. That's what this is all about. That's what this is all about. The #1 cause of overdose death, painkillers. CDC, that was just a year and a half ago. Over here, my wife was watching TV, 2 days ago? And she's got her camera going all the time. As soon as there's a commercial on, she takes a picture of it. Zoloft. How many are taking Zoloft? How many know neighbors that are taking Zoloft? Side effects, as Dr. Wolfson talked about. Heart damage. Creates arrhythmia. Spine damage. Brain damage. Birth defects. All because we are trying to create this mechanical entity and treat it with chemicals, and it does not work, and it never will. Why? Because of the laws of mechanics. All drugs are metabolized in the liver, and therefore the liver is the first organ to have problems if drugs accumulate there. You're taking medications and you're not monitoring your liver enzymes, you're in serious trouble. Whether you're taking 3 blood pressure medications or a cholesterol medication, every single drug, and even that 81 baby aspirin stuff, is going to accumulate in your liver. And simple things that you can do, #1, is have somebody like this manage that for you. #2, take an organic lemon, squeeze it in some water every time you drink water and flush that liver out. Do a detox. Is it because we're smelling, that haze that we see in the valley? No, it's because of this right here. Okay? We look at this slide. Every drug that has ever been recalled by the FDA was first proven to be safe and effective by the FDA. Don't get caught in the middle of that. Okay? #2, the person who takes medicine must recover twice, one from the disease and one from the medicine. Osler, MD. 783,936 people die each year from legal drugs in medical areas in the United States alone. Illegal drugs kill 250,000 worldwide. So the question is the war on drugs, is it aimed at the wrong target? Dr. Wolfson and I both are extremely busy because we're successful with patients. We change their health, we change their mind. We convince them the world's round and not flat. Okay? We take the time out of our family time, both of us have little ones at home, to come here and do this stuff. We're not selling anything, I don't have giveaways. I feel terrible about that. Right? Not really. But you're going to leave. You're going to walk out of here today and you are going to know there's a different way than getting a prescription. Okay? Only 6% of drug advertising material is supported by medical evidence. BMJ, just referenced that today. Surgical remedy? I don't think so. Here we have the front This is the back. Here we have an open hole for the nerve. There's a disc. There's a bone. It's lined up. And then we get down here. And, oh, there's that one. It's out of alignment. And then, oh, there's the tailbone. You see where that bone has physically gone back that far compared to these guys. That's spinal stenosis. It's you driving your car with the front end out of alignment, and you go to Pep Boys and they say, come on in. You got a mechanical alignment in the front end, a misalignment. We're going to weld it in place so it doesn't get worse. And as soon as you let go of the wheel, every time it jumps into the next lane. That is how the best surgeons in the world are going to handle structural mechanical problems. Okay? Now, can chiropractors even cause that? Yeah. Yep. These guys are, doing this stuff. No. Let's get you from the left, from the right, all the way up the back, and take the neck and do this. And you're good to go. No, you're not good to go. Consumer Reports on Health. I'm going to be finished up in just a few. I'm closing down. I'm ramping down. An interview with Scott Haldeman. He's an MD. What's MD stand for? No, come on, seriously. And he's a PhD. And he's a DC. What's DC? Dr. Kai. He's all that stuff. And he still has a head of hair. I don't get it. First trained as a chiropractor, Haldeman received a PhD in neurophysiology and went to medical school and became a practicing neurologist. He is clinical professor in the Department of Neurology at the University of California, Irvine. Good school. And co-editor of January-February edition of the issue of Spine Journal. Let me tell you, if you're writing for Spine Journal, you are above and beyond peer-reviewed. You're above and beyond smart. Okay? And he doesn't even have glasses. Right? Good-looking guy, probably making good-looking. You're married. Get that. He's also former president of the North American Spine Society. Here he is, writing articles in Consumer Reports on Health. And I want to read to you what he says. He says, a question was posed to him, does your chiropractic training add to your care as a neurologist? He says, most of what I know about the spine comes from my chiropractic training. In fact, in medical school, we hardly turn the cadaver over to look at the back when studying anatomy. And I won't even read you the rest. Because those of you that have waited 6 months to get an appointment with a neurologist, to only be told to have a nerve conduction velocity test and then give you a medication. Okay? Neurologists are not experts. They're not biomechanics. Okay? And this guy should know. He's all of them, right? Measuring heat of a mechanical entity gives you a ton of information about the structure and the function. Measuring heat gives you a ton of information about anatomy and physiology. Assessment of nuclear engineering biomechanics, both of them. Look for signs of structural degeneration. If I see a disc that's narrowing compared to its neighbors, you got to get that fixed. Standing full spine film, right? Standing, analyzing the structure under load. Full spine film, because you're looking at the entire structure. Look for signs of malfunction. Measure range of motion and heat differential. Range of motion. When you go to back your car out of your driveway and you can't turn ahead and you just beep the horn and back up, okay, that means you got a malfunction going on. Okay? Analyze the structure and function and produce a plan of action. Because that's the real way to treat the cause, not the effects, by taking medications that have a list this long of side effects. And even so, Fix-a-Flat STP oil treatment is just the exact same thing. They're developed by very smart people. They're developed by chemists. They're not mechanics. Okay? I'm going to have one more slide, and then Dr. Wolfson and I are going to answer questions. Whether structural stuff, diet stuff, we'll stay here and try and go one-on-one with everybody when we're all done. If you would like to talk to us, I encourage you to do that. As I said earlier, if you don't have a cardiologist, you have one now. It's up to you to step up to the plate and say, I'm going to get over that fear factor that if I get off of these medications or I have somebody guide me get off of them, I'm not going to drop dead of a heart attack, because nobody's ever died. Not one person has ever died from high cholesterol. Okay? But people have died from structural mechanical misalignments, from diseased organs they never knew was going on, and they never knew it was related. Okay? So I will do my part. If you're in this room today and this sounds interesting, then I'm going to give you something right here. And this is it in a nutshell. A normal price for me to do a consultation, a detailed mechanical examination, and a full spine film is about that right up there. If you came to this seminar today and you're interested in having somebody look at you from a structural perspective, I'll do it for that. That's as much of the sales pitch as I'm giving. Okay? And if it's not me and you're seeing a chiropractor, number one, never let somebody touch you without blueprints. Number two, don't let somebody twist your neck off. Number three, make sure that there is a beginning and an end. If we have biomechanical misalignments that are showing up on an x-ray, do a process of reconstruction, and then take an x-ray when you're all done and say, there's where I started structurally, that's where I ended structurally. Because that's just exactly what I do. And that's what every engineer does, is that they measure processes objectively. And that's another reason why measuring heat is so crucial, because it gives us an objective measurement of how a patient's doing. When you restore mechanical misalignments into a normal seated position, we're going to see the reduction of heat. When we see the reduction of heat, now we've got an objective measurement that the patient's improving. And then the final thing is taking an x-ray when you're all done. Okay? There are cheaper forms of chiropractic, as I showed you, that you're going to get in a money coupon clip. Okay? But don't trust somebody unless they are an absolute understand joint biomechanics to manipulate, and I don't even like that word because I like to call it restore biomechanics, not manipulate spine. Big difference. Okay? Questions about anything that I discussed today? Yes?
Unfortunately, my friend had to leave, but he wanted to know, so is what you're saying, is yoga no good for him? That's what he wanted to know.
Great question. Is yoga good for you? Is flexion good for you?
No.
There's your answer.
But there's also extension in yoga. Salutations to the sun, you're going down.
Is there extension in yoga? Absolutely.
Yes.
So the answer is yes and no. But what you're going to leave here with today is no. It's a video called video fluoroscopy, or DMX, digital motion x-ray. We can put this on people, and it's just like a video camera looking at the bones and say, bend over, touch your toes. And guess what happens to the openings throughout the spine? They narrow. You cause spinal stenosis. And what happens when you do extension? The openings increase in diameter. It's that simple. No one's ever come into my office, all 5 of them that I've had over 12 years, and said, I hurt my back, doc, doing this. It hasn't happened, not one time. It's always, I did this and I did that, or I did this and I'm pulling weeds and I'm doing this, and I was taught to exercise, doing sit-ups with grabbing my head and doing this. You don't have to do all that. Flexion is your enemy. The problem is that you cannot get through a day without putting your body in flexion. So, when you put your body in flexion, you increase the law of entropy. These decrease the law of entropy. Medications do not. Yes?
Another question is there a mattress, you know, because we spend 8 hours a night sleeping.
No.
Is there anything on the market, one better than the other?
I get asked this all the time. What kind of, should I buy these $2,000 cervical pillows and these crazy mattresses? Absolutely not, because if you have good biomechanical spine, you can sleep on a floor and not suffer the effects. Okay? I don't push mattresses. I don't push pillows. That's a waste of money. Certainly, I think the bed I just got rid of, what do you think, Sil? How many years old? 25? 25-year-old. And I loved it. You get in it and you sink all the way to the ground. The bed comes down and wraps around you. You look around. She made me she got rid of it. I came home one day, like, where's my old bed? My spine's in pretty good shape now. It wasn't. Okay? My chiropractor just left out of here. Dr. Jack, in the back.
After you restore the biomechanics, are there exercises that you do talk about to your patients to kind of maintain The alignment?
Yes. The question is, after the mechanical correction has been corrected, what can you do to maintain it? And the answer is absolutely. And this is one of the reasons why, because I looked and looked and looked for a program that accentuated extension stretching. And guess what I found? Nothing. So I was compelled and led to write a book, and that's exactly what I did. I wrote a book, and I always wondered, why do people do physical therapy after surgery or after an injury? Why don't they do physical therapy before? And so I wrote a book about physical therapy, and I took the exercises in physical therapy that accentuate extension. Why? Because I know extension keeps vertebra biomechanically in a forward tucked position. And so I minimize flexion. Even doing sit-ups, you can do that on a ball and raise up towards the ceiling without putting the body in flexion. Getting people to get away from sleeping in a fetal position. Getting people away from looking at the ground when they walk. Keeping that chin above the normal line. So exercising in extension. The problem is you cannot get through a day at some point in time. You got to bend over and tie your shoes. You got to put socks on. So knowing that, you know you're going to have somebody managing and maintaining your back mechanically, period. Number two, knowing that if I take and I put my body in flexion for 80% of the day, and I do this for 20%, and if I even that out and I put 50% extension into my day and I reduce the amount of how I bend over and kick a leg back, and now I'm using muscle groups to pick something up, I'm not putting my body in flexion, versus this, modifying your lifestyle. Exercising and extension will maintain healthy biomechanics. And this is what I talked about on Fox News this morning. Okay? It's hard to, in 4-minute segment. Yes, sir.
Name your book.
What's that?
Name your book.
Name of the book? Rehab with Dr. Robb. If you're interested in that book, let me know. Okay? Yes, ma'am.
How do you correct the misalignment, whatever, if you don't do the cracking?
Yep, good question. The question is, how do you restore biomechanics without cracking the back? Okay? First of all, the theory is, and it's not been proven, whenever the bones are separated, there are two facet joints on each side of the bone. The facet joints have capsules in there that accumulate a gas. So when you compress those capsules, it releases the gas and makes that noise. So, in other words, you can't get that bone from being mechanically misaligned backwards to pushing it forward off the nerves without physically moving the bones. So, do we walk up and put the patient on a table, face up like this, and then take the neck and go? No. Number one, you can't push a bone forward if a patient's lying on the back, from Georgia. Face down, finding that one bone that's sitting back, not cracking all back, and pushing it one base at a time. A process of restoration, like putting braces on crooked teeth. It's an accumulative process, and every adjustment builds on the previous adjustment. What's the average? Average adjustment time is about 90 days to take somebody with full-blown degenerative disc spinal stenosis and take an x-ray and see the diameter opened up. Number of visits spread out over those 90 days, anywhere from 25 to 30 visits. Okay? But you have to move the bones. But you do not twist the bones. And you do not crush people. The majority of my patients in my other offices around Peoria and Sun City were dealing with a lot of metabolic issues, bone density problems. So you can't have somebody who's going to do on these things. And unfortunately, that's a bad, bad problem in chiropractic. But people do not know that there are different approaches of chiropractic. Okay? And that's one of the reasons why we're here. Questions?
What is your method called?
The method that I practice is called Gonstead. Gonstead. He was a mechanical, in the automotive industry, a mechanical engineer. Back in 1923, graduated, and he developed a form of chiropractic, very rare, that is based on the principles of mechanical engineering laws, like what I talked to you about today. It is not the random rack and crack. It is a different level, because the patient is constantly monitored and measured through their progression, and then there's an ending point. So it's much different. GonsteadSeminar.com, all one word, will give you a list of the Gonstead doctors in the entire world. There are only a handful, 6 of us in this state. There's on average of 5 to 10 in most states. Now, there are some physicians out there that will say, oh, I do a little bit of that Gonstead stuff. It's like being a little bit pregnant. It cannot happen. Okay? It was a good fit for me because of my engineering training. And I look at people just like I would a nuclear weapon. Right? Not really, but you guys are all that dangerous. Question?
Tell them my favorite extension thing at home.
What's that?
We don't have a table where we lay on the floor and put our head up.
Yeah.
Anybody can do that.
One of the best stretches that you can do. We all see our kids lie on our stomach, put the hands here and watch TV like that, right? That puts the neck in extension, it flattens the thoracic spine out, and it puts a curve in the lordosis in the lower back. Phenomenal, phenomenal stretch. Very simple. Yes, sir.
How would you treat the osteoarthritis, hip osteoarthritis, with the biomechanics? Because there is no cartilage left, so there's nothing to do with it.
Good question. The question is, where does the role of biomechanics tie into osteoarthritis? Osteoarthritis is not a disease. It's a process called Wolff's Law. Again, another law of mechanics. Wolff's Law says that the bone will remodel due to asymmetrical stresses into the joint. If we have a mechanical misalignment, now those compressive stresses are going to cause that bone to increase in density. That's why you're supposed to exercise, to increase your density, because it stresses the bones. When you stress the bones, it increases in density. When we have asymmetrical stresses on a joint, then it increases the density. And what do we call that? Bone spurs or osteoarthritis. The unique thing about that is that it's really not the same mineral density as bone itself. So osteoarthritis will develop, Wolff's Law will develop on joints that don't have any mechanical motion to them or very little. So that's the same thing as if I have, and I pop the hood of my car and I see a bolt there that I have not turned in a long time. It's more than likely it's going to have what built up on it? Rust. I call that a disease for the bolt, right? It's not. It's happened there because of a lack of mobility. Rust can't grow on mobile entity, and osteoarthritis can't either. So when you restore mobility, to a joint, and you get that bone moving again, the body, in most cases, will reabsorb that calcium that's built up in the form of bone spurs. And that's evident on post-X-rays. It's measurable. And this is the thing. People are told once you have osteoarthritis, there's nothing you can do about it. This is the evidence that there's a lot more out there that you can do than just take medications. If you have osteoarthritis, you got two things going on. You got a metabolic issue going on. Number two, you got a structural problem going on. And you address both of those, you can recover from osteoarthritis. Question? Okay, yes.
Can your system help with scoliosis?
This is another interesting topic, scoliosis. Number one, when you hear the word scoliosis, you have to understand and you have to ask what kind. Because if I have 4 building blocks like this, okay, and I have a series of these blocks, and they're all square and they're level, then we don't have any scoliosis. But if I have a malformation of a joint, and sometimes we do that, now we're going to have adaptive curvatures.
Right.
So is it the job of a chiropractor to take curves out of the spine? No, it is not. If the curves are in the spine because they are compensatory curves from an unlevel foundation, in an engineering sense, absolutely. You can reduce those curves, and the sooner you get a hold of that, the better. But kids that are developed with scoliosis, and they have a malformation of a vertebra, you let them grow up just like on a paleo diet, because their body will adapt to that. 80% of you sitting in this room right now have one leg longer than the other. That's stats. So when that happens, what happens to the foundation? What happens when you build a house on an unlevel foundation? Structurally, you're going to see the roof leak. So the body is unique because it adapts to that. You have one leg longer than the other, and you got everybody trying to put orthotics in people and heel lifts. The body adapts to that. But what the body does not adapt to is when the bones go where? Backwards. That's the problem. Scoliosis, I do not make a big deal about it. And yet the medical approach is to bandage these people in braces and so forth. And it's ridiculous because that causes muscle atrophy. Okay? Scoliosis, if it ain't broke, don't fix it. Maintain it. Okay? Any other questions, guys? Okay. Dr. Wolfson and I'm going to take this thing off. Thank you. Dr. Wolfson and I will stick around. My staff is here in the back, the two beautiful brunettes. If this sounds interesting to you, then please schedule you an appointment right now, and I'll offer that special for you. If you have friends that should have been here, you tell them to get a hold of me, call my office, okay? And I encourage you to carry on more conversation with Dr. Wolfson, and will stay here and talk to you as well. And I really sincerely appreciate every single one of you for coming out of your busy schedule to listen to us do this today. Thank you.